Good morning, everybody. My name is Dr. Raj Gupta. I'm a Neuroscience and Stroke Director at Regional Medical Center. And this video is made for HCA Board of Directors, which include Thomas Frist III, who's chairman, Meg G. Crofton, Hazen Bob Dennis, Nessie N. DeParle, William R. Frist, Hugh F. Johnston, Michael W. Michelson, Wayne Joseph Relay, Andrea B. Smith. I wanted to talk to you in person, but it seems like that was not possible, so I have been forced to make a public video. I did send an email to all of you on June 21st, 2024, and I did get an acknowledgement when I received a text from our CEO, Matt Kova, on June 26th. I had a phone conversation with Far West President Jackie Van Blaricum on June 28th for about 8 minutes. However, nothing has changed on the ground. So I would strongly request all of you, especially Dr. Wayne Joseph Relay, you are the only doctor on the board, and we are represented at Nashville. We don't have any local board of directors here. So I hope I can impress upon you to read that letter, go through impact study, see what is at stake. Now, just want to clarify, we are not against HCA, but this very decision goes against the core principles of HCA, as well as first principle in medicine, do no harm. And there's a serious chances of harm to the public. Now, we had a grand rally of physicians, nurses, staff at hospital, as well as politicians and public this Tuesday. Now, I will put the links to the videos of those speeches, as well as participation by the public. I would strongly suggest Board of Directors go through those speeches and see how the public see this move. Now, from my experience, I can tell in the battle between people and profits, people always win. Although profits can have small victories, but in the long run, the crushing defeat is in store. And if you don't learn from history, history repeats. Now, let me tell you why RMC is not making money. It is not the expenditure of these programs. It is the burning of the bridges of the community physicians, especially surgeons, by local hospital leadership for decades. First, our local anesthesia group was let go. Then our local emergency medicine group was let go. These two departments, after so many years, they are still in rooms. Can you imagine you could not get even a single local ED physician to take job as director of ED services? Dr. Hashmi, who had it, he resigned. Does not it speak something? You have to go to all the way to East Coast to recruit Dr. Gabriela Amaro to take the job. Why most of the physicians in ED are locums? Can you imagine you have cardiothoracic surgeon on call, but no tech available? We are the major hospital who does not have much elective surgeries. So I recall when I went to HCA headquarters in February 2020 during Chief of Staff Leadership Academy meeting, and I was taught an ideal hospital should have 70% patients should come from ED and 30% through elective admissions, especially surgeries. Now, your local team should tell you the stats, but what I can tell you in regional, 98 to 99% come from ED. And there are very negligible elective surgeries or elective admissions. You know why? It is a hard work to get local doctors or surgeons to feel comfortable bringing their patients there. It is leadership, local leadership from HCA is very unstable. We have no CFO for years. CMO position has been eliminated. Local leadership like yes man physicians and whoever tells truth is shown the door. Local administration is surrounded by leaders who have conflict of interest and unable to speak truth due to their financial ties to the positions they hold. They want to speak. I know them personally. They are very great physicians, very great colleagues of mine, but they can't speak out. Now, respected board of directors, closing these essential programs won't help RMC or HCA, but will cause serious harm or even deaths daily to highly dense metropolitan area of San Jose. You cannot bring back a dead person with shoving money into the mouth. Whole narrative by your local team is so wrong and shameful. Adding 20 beds to the ED is of no use to the situation, as there won't be any ambulance traffic to RMC. You won't need those 20 beds. Your spokesperson is ridiculing HCA by saying only 2% of the patients will be affected. But what if these 2% of the patients are the sickest of the sick and need our help the most? I don't think any patient in right mind would come to RMC after August 12, as they won't have many life-saving essential services, and especially when you have choices to go to other hospitals for less emergency services. There's a real danger, and I'm going to repeat, there's a real danger of the collapse of the RMC. And if that does occur, there will be a loss of thousands of jobs for doctors, nurses, and staff. I'm sure there are many ethical, value-based investors who are looking the whole situation and who will withdraw their investment with HCA. People are the real power in democracy, and they will understand what HCA is doing in San Jose, may boycott HCA hospital all over the country. You will never win a battle against people. We are supposed to help people. I demand you pass the closure, you pause the closure, send a fact-finding delegation of board of directors, especially physician, meet with local physicians, find the truth, and I challenge, if you find out I'm wrong, please fire me right away. However, if I'm right, and if your local team is wrong, I don't want them to be fired, but to be taught HCA principles, core values, core missions. Our core value is, above all else, we are committed to the care and improvement of human life. It seems like the local leadership has changed this code to, they have eliminated the first 3 words, and they have changed it to, we are committed to the care and improvement of human life. And they added these 3 words, only if we make money. That is so wrong. We should also follow course by our HCA co-founder, Dr. Thomas Frist Sr. And he said so beautifully, and it touches so many lives. He said, bricks and mortar do not make a hospital. People do. The great hospitals will always put the patient and the family first. And the really great institutions will provide care with warmth, compassion, and dignity for the individual. I hope to hear from you by July 16th. And the reason is, if we don't do by that time, these programs cannot be salvaged. So this is a critically time-sensitive issue. We are also expecting to hear from our governor, Gavin Newsom, or Attorney General Rob Bonta. And if we don't hear from any of 3 institutions, I think our fight will go to the national level by involving our respected President of the United States, Joe Biden, and Honorable Attorney General of the United States, Merrick Garland. Remember, our petition is signed by 8,640 people, including thousands of doctors, nurses, and medical staff. This is the battle between people and profits, and we cannot afford to lose. Thank you.